And we're live. Welcome, everybody. And look who I have right there. It's my special guest. I wasn't sure if Dr. Kim was going to be able to join us tonight. So I didn't kind of advertise that right off. But I was so excited when she said yes, yes. She had this half hour so that she could play with us a little bit. And I am so thrilled because it's so nice to have somebody who is an expert, especially in that traditional Chinese medicine and as an acupuncturist, because she's able to give us a little bit of a different viewpoint that maybe I can, coming from more of my Western thoughts. Right. So now you're going to get a little Western and a little Eastern, and we're going to put it all together. So, hey, Kim, thanks for coming on tonight.
You're welcome. You're welcome.
Oh, thrilled. So what we're going to do tonight, you guys, is I do have a short PowerPoint. We're not going to do a whole lot of it. Just going to start going through how to use the blower. So on Monday, we kind of talked about what it is, what happens when you turn it on, how the terahertz goes right into the body, etc. So now we're going to take it to the next level. What's the best way to begin to use the blower? And then we might even get into as you continue to go on to use the blower. So we're going to give you some structure, and then we're going to unstructure and really allow you to create your own treatment plan. How's that sound? Good stuff.
I think it sounds great.
Me too. All right, so let's go ahead. We're going to put up the little PowerPoint. We always know I love this one, putting the power of the hertz to work for you. All right, so have to do my medical disclaimer saying that these wands are certified household electrical equipment. That is not medical. It is not a medical device. It has been certified as safe to use, emits no harmful radiation, and has labels allowing for its distribution internationally. And it really is important to know that it is not a medical device. It's not medical equipment. And especially as we go through tonight, I want you to just constantly understand that we're using frequency. And when you put frequency into the body and structured water, etc., every one of our bodies is going to take that beautiful healing frequency and it's going to use it to help itself heal. Okay. The wand is not healing anything. It is not a medical heal. So as we go through, even if we have a few words, we're going to be very careful to not make a diagnoses. And if we use a diagnosis right off, I'm going to say it's not that we're curing a medical diagnosis, but if you have something with a diagnosis that gives you a certain amount of symptomology, it's that we are able to kind of use that diagnosis to kind of give a whole understanding of what it is that we're dealing with. All right. So just understanding that right off. And let's just begin. So when we get that wand, we open the box, we're so excited. What is the very first thing we want to do? And that is you want to, what we call, wand the water. Now, why do we wand the water? The water is a huge part of the treatment plan. And what's happening when we actually put that terahertz and the scalar energy into the water, it changes the structure. It's actually called structuring the water. And it takes these molecules from clusters like this into a much tiny linear structure. And the reason that's so important is because when you have a cluster, you're trying to get this water into all of our, how many trillions of cells we have? I have no idea. Trillions of cells. But the places that the water can get into on the cells, they're small. So that cluster, a little bit of the water will get in, but not a whole lot. And so we can end up with edema and outside or extra matrix water, but not intercellular water. And we really want to be able to get that water right into our cells so we can actually hydrate the body, allow those cells then to clean themselves out. On the one hand, you get rid of the metabolic waste. On the other hand, you bring in that healing oxygen, the nutrients, and the hydration. It is so important. So I want you to understand there are some people that only get it just to do the water, and it is just that powerful, especially when you're starting to do the blowing on the body, there can be a certain amount of toxicity that's released. So you want to be cleaning out those cells. And when you look at this particular slide, I love this because it starts to show you just some of the things that are helped when you are hydrated, okay? Reducing blood pressure, anti-aging, anti-acid. It helps you to detox. We're just doing all these different things, improving memory and cognitive functions. So I know Dr. Kim is really, she's an expert on brain balancing. We did a little on brain balancing last week. So how important, Kim, is just hydrating?
Very important. I think it's number one. Don't you, Renee? I think, hydrating your body and nourishing your body with water, and then even thinking about blowing the water and using that for just, the molecular structure of how it changes it. I mean, it's just, so all of a sudden, we've been drinking water, but now we have the ability to even change the molecular structure of it. So, so nourishing. It's just is feeding every cell in the body. Right?
Absolutely. And I know for myself, I do not like to drink water. That is big, big personal trainer confession, right? I would tell everybody else, oh, you got to drink water, right? But the truth of the matter is I didn't enjoy it. I would choke on it. I didn't like the feeling of it. I never really got the sense that I was actually hydrating with it. So when I got this and I started wanding it and I took a sip, I was like, oh, this is very different. This is not like drinking regular water, even bottled water. Why? Because when you structure it like this, it is changing the texture of it. We call it changing the viscosity. So it's taking it where it's just really super smooth and it just goes down really well. So even if you're somebody that's like, oh, Renee, really, I hate drinking water. I get you. I'm with you. But just give it a shot. Go ahead and just start to down it. I can drink a big glass of this wanded water and it just goes down so beautifully. Whereas I drink regular water, not so much. So highly recommend. You really want to get it out and start to structure it. Now, how does we do this? This is how we do it. So interestingly, there's the wand. Here's our beautiful little classic wand. And you can just point it at the water and blow. Now, you have to blow through glass. That's a number one rule. That's one that you don't want to break. So tonight we're going to tell you, here's a few rules that you really want to stick with. And then here's some rules that you can play with, okay? Wanding through the glass is one that you don't want to break. You don't want to wand through plastic. Yes, it will go through plastic, but you don't want tiny plastic particles also to come off along with that in the frequency into the water. You don't want to wand in metal. Now, can you take the wanded water and after you're done, can you take it into something else? Yes. Here's my metal thing. I make the tea. So I do a big jug. As you can see, that's my setup. And then I use that water all day long. So I'll use it for my tea, for my coffee, for my water, for my shakes, right? For my green juice. All these things you use that water for. So no, you don't need to get a big thing like that. You can just get a glass bottle and just blow through it. How long? Let's talk number one about duration. So if you're just doing it, just a regular 16-ounce glass of water, which you certainly can do, 1 to 2 minutes should do it. I have this big, I think it's probably like a 2-gallon jug. I have no idea, but it's pretty big, as you can see. I just set it there and I turn it on and I leave it for maybe 5 to 10 minutes. Really what happens is I turn it on, you guys, and I go away. I leave, I go into my office or do something else. And imagine this, I got distracted. And then pretty soon it's like, oh, I can't stand the sound anymore. Let me come back in. So that's why I say 5 to 10 minutes. You can't over wand it, so you don't have to worry about that. And how do you know it's done? Because you're going to taste it. You're going to put it in your mouth. And if you can tell the difference in that texture and it's smooth, it's done, which is a beautiful thing.
Right.
Let's now talk about temperature. Okay, so what we know is frequencies are more active in room temperature water. Kim and I were talking about this earlier together. Room temperature or warm is perfect. And so I just kind of fill it up. I usually put mine on a little bit, fill it with like warm water. You just don't want really cold water. You don't want cold water because it's not good for the body. Right, Kim? Tell us about, like, in Chinese medicine.
Oh yeah. Well, cold water will cramp up your gut. It stops metabolism. It will, it doesn't help your gut, your relationship with your gut health. And so it's just like anything, warmth on your body is so much better than cold, right? But warm water or room temperature water, we hear everything, you hear all different points of view. And if we didn't have different points of views, then we would have no Google. So, and we all love Google and we all like to search Google for something. So, but warm water is the healthiest, non-iced water is so much better for our bodies. It can be warm water and no ice water can help you even lose weight. It's just, it's that whole metabolism thing. And it's the nourishing again, so you're not only getting the nourishment of the blown water, but you're getting nourishment of a room temperature to warm water.
Yes, beautiful. Thank you for that. Yeah, I had asked him because I had seen somebody in on YouTube who was talking, also a distributor, and I could tell quite educated and really understood and had some really great things to say. But he was saying, "Oh, you need cold water," and I thought that just goes against everything that I know, and it goes against my intuition when I drink it. So I was asking him, and so we're in agreement. Doesn't make him wrong, doesn't make us right. Just that's what we're feeling. Okay,
Right.
so you can just take that with a grain, and if you love cold water and it works for you, okay, all right.
Sure.
So let's talk now about the setting on the wand. That's another question that we get. So the red classic wand has 3 settings, a 1, 2, and a 3. So when you turn on number 1, we call it a high blow. It's like a loud, and it's a high volume, and it's not real hot. It's kind of, I'm going to call it a cool setting, but it does have a certain amount of heat, but it's not high. Then the second one isn't quite so much of a blow. It's not quite as powerful, and it's a little bit more heat. And then the third one is a high blow, high heat. And really, really, it's so individual and personalized as to what setting you're going to use to do what. Okay. So with the water, you can just put it on number 1. I personally put my wand on number 1, mainly because if I go knowing that I'm going to go away and I get distracted, I just don't want the wand to heat up too much. If I want to use it again, it can cool down. So I just put it on 1. I don't worry about it because I'm not trying to heat that big pot of water anyway, right? So I just do it on 1. Again, you can do it on 2 or 3, personal decision. I like it on 1. What do you do it on, Kim? Do you have a preference?
No, I would do 1 also. I like that. I just do it.
Okay.
Just seems to be the right.
Yeah, that's how I feel too. I don't really want to put it on super hot.
No.
I don't want, it just doesn't. But anyway, again, personal, we do it on 1. So you can kind of take a look and see what you like to do with that.
I think Cheryl commented over here that, and no need to blow on high heat either. So right. I agree that way.
Right.
Yeah.
Ellie asked, what about ceramic? And I believe that it does go through ceramic as well. Because ceramic is, anyway, I think it's a type of glass. I don't know. So maybe it's more of a mud. I don't know. But I have heard, Ellie, that you could do ceramic if that's something you wanted. So here's the thing. You know what? Try it and just see, did it change the texture? That's the thing. You're going to know there is a definite difference in the texture. Okay. That's how you're going to know. It is softer and smoother. Yeah. So that's the first thing. All right. So now we're done with the water. We're wanded. We're drinking our water. Now we're going to go to what we call this the basic protocol. And this is just the way that we feel is really a great way to start to use the wand on the body. Now, right off, I'm going to say, do you have to do the 10 steps? No, you don't. Okay. But it is a nice way to start. And the reason it's nice is because what you're doing is you're going to be opening up the energy channels in the lymphatic system. So you're introducing these frequencies and allowing the body to just start to to feel it, to start opening up. Kim, do you have like better words? How would you say would be?
I would, what we talked about earlier was keeping this whole step by step very, very simple. You don't have to complicate this. And I think, wand the water and go through these steps. I think they're beautiful areas, acupuncture point areas. I think it works. Right. How simple is this chart, right?
And, Kim made such a good point earlier, too, when she was saying, one of the things that happens to so many of us is we humans, our human mind, we love complexity. So, we take something simple like this, and I'll go through it in a second, and then we try to complicate it. And then we try to find why it won't work and why it will work. And what happens if I do this? And then we get into all this complication. And then, well, I don't have 20 minutes. I only have 5 minutes. So will it still work? So you know what? We complicate it, and then compliance goes down, because then it's like, oh, it's just too much. So keep it simple, okay? Yes. Really keep it simple. You don't have to do all these steps, okay? You don't have to do any of it. Keep it as simple as possible so that you will keep doing it. The bottom line is turn it on and blow. Really, right. If you don't do it, you won't get results.
I think even if you said, okay, I'm not going to go through all these steps, it's yada, 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 and I think if you just wand the water, blow the palms of your hands, blow the bottom of your feet. Very important. The bottom of the feet to me, that's the et al. I do it to every patient, and just leave it there and drink some wanded water. I mean, right there, you have made such great progress, and you don't need to do a whole bunch of steps. I mean, yes, adding those other steps, hey, why not? Because of the lymph system and because of the doing the back and working with all the organs, sure. But it doesn't, but you're going to get the same progress and the same effect just doing the palms of the hands and the bottom of the feet.
How cool is that? Thank you. Yeah, thanks, Kim. So we'll take you through, though, quickly so that you can kind of get a sense of it. So you see, first thing, it's drink 2 glasses of that warm water, okay? Then we do the palms of the hands. And we're going to show you, I have some reflexology charts to show you how much there are on the hands. But for right now, when somebody, if you haven't gotten yours yet or you have it, like, what do we do? You're going to turn it on. I won't because it's loud. Again, what temperature? Whichever setting you prefer. Okay. So you're just going to go like this. How far away from the hand? It doesn't really matter. See, that's a rule that you don't need. Just wand. Go like this. Circles, go here. You might want to go in between, right? All here, but just wand the hands. So on the chart, it says wand one hand for a minute, then go to the other hand for a minute. Kim, your experience, does it matter whether you go clockwise or counterclockwise? Sorry, I didn't prep you that I was going to ask that question.
But I laugh about that because you hear, again, so many different opinions. I don't think that it matters which way you go, just so you blow. And, so just think about that. Doesn't matter which way you go, just blow.
Just blow.
Yeah.
Now, does it matter if you do only one side as opposed to the other hand?
And I am an acupuncturist that can treat one side of the body for a whole treatment. So some people want that balance, and if we're talking brain balance, you want to go here and you want to change and go here, right? So you change and change. But it doesn't matter if you just treat one hand, you can treat one hand, just like you can treat one knee. And believe it or not, acupuncture in Chinese medicine, traditional Chinese medicine, it will mirror. You can treat, in traditional Chinese medicine, you can treat the shoulder for the hip, for the opposing hip. So, and of course that's really confusing, but back to that, I don't think it matters that you need to do both hands.
Okay.
At all. So
right there, if somebody is really for time, they could do maybe a minute on one hand, Maybe do the other foot. Do the
Right.
bottom of the foot. Maybe do, it doesn't
Yeah.
say ear on here. I happen to like the ears, but that's not part of this. But, again, you could do that.
Right. And I would definitely do the opposing hand,
Opposing foot.
and then the opposing foot. I would definitely do the opposing. So you're basically doing both sides of the body.
Beautiful.
Beautiful.
Yeah. So you heard it here first, you guys. There you go. So if we're following the protocol this way, 1 minute on the hand, one hand, then switch. And what Kim was referring to is last week we talked about brain balance. So you're using one hand, some of my left hand, to work the right. I'm holding it in the left to work the right. Yeah. So it's always opposing, and that helps to balance the brain. So just a little bit of brain balancing as well. Then you go down to the feet. Essentially, just pretend like this is my foot. You're doing the same thing. You want to do here, maybe in between the toes, maybe even the tops of the toes, and then the back of the hand. Okay, and up, and just play. Just play, because it's going to hit all those points. It just doesn't matter. Just keep going. So those are hands and feet. You could stop right there, as Kim says. That's what she basically does, that you could stop. Yeah. But if you want to keep going, the next part is just behind the knee. And you just do it the same way, a little bit like this. Maybe just go one, maybe do both. Why behind the knee? Because that's a place where there are a lot of lymph nodes. So now some of these other parts are also opening up in the lymph. Now, why the lymph? Well, because our lymphatic system is part of our bodies. It is our big part of our body's detoxification system. And you know what? We are so toxic. Our lymphatic system tends to be very stagnant. I know mine is. Again, I'm a trainer. I move all the time. I could be working out all the time, and I still know my lymphatic system is still stagnant. So just using this, I've noticed such a big difference. So the lymph and the fascia are all completely connected. Well, the fascia is in everything anyway. And it also goes right along a lot of the meridian system. So we're covering all of it. So right here behind the knee, there's actually a lot of lymph nodes. Up there in the groin, you can do that. And then armpit, these are all places for the lymphatic system. So you're doing it in this circuit that keeps everything moving, and it's going to end up going to your organs of elimination. So your kidneys, your liver, your spleen, your skin, breath is also another place. So armpit, so you can do the pit. How do we do the pit? Same thing, opposite. And you just go into the pit. It's really as simple as this. If that's a little warm, right, for wherever you're doing, you can take it out a little bit. Doesn't matter. You can go a little close. You can go away. One thing that I do tend to do is move it around, though, a lot. I try not to just keep it in one place because it can get kind of warm. So you do want to go all the way around it. And that way you're also getting all the different points that you're doing. And then lymph in the neck. We have lots of lymph nodes. You might remember, especially as kids, right? We'd get those swollen glands, they call it, right? But we all have that, and you can feel it here. So you want to, again, wand on the neck. You can do one side. You can do both sides, all right? Doesn't matter. Top of the upper back, just right in here. If you cannot reach, go from the front, okay, and go back. That's always a question. And now I don't have anybody to wand my back. It's okay. Go from the front. Visualize the back. You can feel it all the way through the back because it does penetrate into the body to 30 centimeters. So that's why you don't have to worry about specific on the back. If you don't have anybody, do the front.
You know, if you take, well, Renee, you have the wand. I don't have mine with me. So if you take it and hold it like this completely, well, that's blowing all the way down your back. See, that's what I do. You know, I don't have somebody, well, my husband would do that for me, but he'll move around. He won't go where I want him to go. You know, you know how partners are. So, but you know, straight, if you go straight down.
Yep. You can feel it.
Yeah. You're going the whole line. So you don't have to figure out who's going to blow your back. Yeah.
Perfect. I love that. Now, if you really are, you don't have it, you have a bad shoulder or whatever and can't do that, again, then we have another. You can go this way.
Sure.
It's fine on the front and on down the back. So there's always a way to do it. Okay. I know I've seen people try and getting these holders and handles and blow the water up and over and it splashes. And if you like gadgets and you're all about that, that's fine, but you don't have to. Okay. Right. There's always a solution to that. That was cool, Kim. That's a great, I actually do that, but I hadn't thought of it in that way. So good to
You're
know
still
that.
doing it. Yeah.
Yep, absolutely. Now, top of head, there's a little part in the top of the head. That's another way you can just top a head and bring it down as high or low as you need it to be. There is a contraindication right here, though, that I do want to mention. It says it down here. If you have high blood pressure, you don't want to be blowing up there on the top of the head. Now, I get this question all the time. It's like, there's the contraindication. And then people are like, well, why? Well, can I do it anyway? Well, what will happen if I do it? So, Kim, will you explain why somebody with high blood pressure doesn't really want to be blowing top of head?
Yeah. Well, the top of the head, you're bringing all the energy up here. So you're bringing everything from the heart, high blood pressure right here, so you just have to be really careful. It's hot. It is, it's activating all those acupuncture points, all those also any kind of it can activate lots of hair follicles. So if you don't have blood pressure, that's the place to go.
Yeah, it does.
But everything that happens at the top of the head, if you want to treat the top of the head, the bottom of the feet. Yeah. One of my big suggestions for migraine people is when you get a mic, let's say that somebody's traveling and they get a migraine, and most people know what a migraine feels like. Anyway, the best thing to do is go to the bathtub, run some hot water, and put your feet in that hot water. And that will take everything from here all the way down and out the feet, because that warm water pulls and it works each and every time. So that's exactly what that acupuncture point on the bottom of the feet was doing too. It regulates blood pressure. It will get rid of headaches. You don't have to blow on the headache. And if you have a high blood pressure and you have a headache, put it on your feet. So.
Wow, you guys, is that not a great tip? Oh, I love that. Thank you for that.
You're welcome.
I know, and I've also seen where people with high blood pressure too will take it, and it's recommended maybe go down, like down the arms, the arms, maybe even down the spine, down the front. So you're taking all that pressure on down, right? Now, would it be opposite if you have low blood pressure? Would you go up?
Oh, yeah, you could go. Yeah, definitely would go up. It's the same thing with constipation and diarrhea. You would, if you have diarrhea, you go up, the spine. And if you have constipation, you would go down.
Man, perfect. Thank you for that.
To do that, I, in fact, just treated a baby that had chronic constipation, bless his heart. And we used the wand on him the other night. And I just went down the spinal process. And he's good today. So, right? So you can do that too.
Love that.
Yeah.
Man, you guys. Okay, so that's a really good one. All right, so then we go to the little tush point right here. And you can just like this, just like this. Okay, if that's a place that you want to go, if that's uncomfortable for you, that's fine. Don't do it. And then we have spine, and it says blow downward. So that was what Kim was just saying. So we're going to go down with basic protocol. Okay.
Right.
Doesn't mean if you go up and down, it's fine, unless you have that high blood pressure, right? So you can go up or just down.
Right. But if you hang that blower, you're going down.
Yeah. Perfect. So you're going right down and you don't even have to move.
No.
There you go. And that's it, you guys. That's the basic protocol. And then you do want to drink a couple more glasses of water just to rinse everything through. Yeah. So it's that easy, keeping it simple. Again, as Kim said, water, hands, and feet. You're good. Okay. Right. Water, hands, and feet, and you're good.
And don't like overcomplicate. We talked about this too. A lot of people will take all these supplements to help their health or wellness, and then they aren't compliant because it's just too much. Right. Do not go crazy. I mean, keep it simple, because you're going to be more consistent in your treatment, keeping it simple than adding more and more, different positions, different, let me do this, let me do that, let me do this. So
beautiful. Keep it simple. So I just thought that I would put a couple of these slides into for you guys because, we're talking about hands and feet. No, these charts are not acupuncture points. They're reflexology charts. Just to show you that, again, when we're doing that, we're hitting everything. Reflexology is its own modality in how their system has worked out what parts are what parts. Acupuncture has its own, but the bottom line is you can see that there's so many different points. Everything is on the hands. When you blow in that on the hands, and we'll show you the feet, the same thing. I mean, you are getting the body. So when people say, oh, well, I have something in my heart, I have a heart stent. So does that mean that I can't blow? No, it doesn't. You don't want to blow over any implants. So we haven't really gone into the contraindications, which I'll do in just a minute, but that is a big one. So you don't want to blow directly over that heart, but do hands and feet. You're going to hit it anyway. Right here in reflexology on this toe is your head and your brain. I thought I saw heart. It's so small here, you guys. And I guess I need to blow some more on my eyes, huh? Head and brain. But anyway, you get the picture. You're going to hit it anyway. You don't have to know any of these points. All you're going to know is that you just blow. What you know is that you blow.
Right.
I like it.
The heart was on the left foot in the kind of the upper part. See that little red area?
Yes. Yes. Oh, right here. Thank you. Here it is, right in here. So, and interesting, beautiful. So, and when you're going to do it, you're going to hit it. I mean, you can't but hit it. So,
right.
One. And the ears. Now, this was not part of the basic protocol, but again, you don't have to stick with that. The ears are so beautiful, and I know that Kim is really loves what's called auricular acupuncture.
I do.
Yeah. Any specific points, Kim, or anything you want to mention about this one?
See where the reflexology chart gives you the hip point?
Right here.
Yeah. That is also in acupuncture. That area is for calming you. And it's called Shen Men. We did that in, I don't know, some other talks that we did. So that's a really good point. And then, of course, I'm looking in here too. But no, I think that, the earlobe right outside the earlobe is great for the earlobe points. It's great for tooth pain, dental work. Yeah. Outside towards the front is good for appetite suppressant. So, you can do just everything here and take care of it all.
Yeah. I mean, isn't that just amazing? The body is so amazing. I just think it's fascinating. So from here, I'm just going to go just a couple of additional places to go. Now, I want you to understand, though, I'm just going to share a few things. Like this says frozen shoulder. I'm not saying this is some diagnosis. The only reason I wanted to just show a few things is because, here's a difference between Western medicine and Chinese medicine, or I'll just call kind of the Eastern, almost like philosophy. In the West, we are so, I'm going to call them isolated, right? There's a doctor for an ophthalmologist just for the eyeball, right? There's a doctor just for the gut. There's a doctor just for a podiatrist. We separate all the parts of the body and we just go to that one specialist where we think we have, a symptom. And they go and they just treat that one symptom without necessarily understanding that symptom may be coming from full body, In Chinese medicine or in Eastern, they really recognize that this beautiful organism is all part of the environment, right? When we talked about how different the seasons, the body adjusts for the seasons and how the body works as a whole. So exactly as Kim had mentioned before, like sometimes there might be a hip issue and they're going to work on the opposite shoulder because they understand, especially with fascia, you move one, it goes the other, that energetically it's all together. It's not isolated. All right. So when you take a look at some of this, I want you to understand that, you are really going to be your own guru, if you will, your own doctor, your own experiment of one. Because even if you look at a quote protocol, right, and you say, well, gee, I have frozen shoulder and this is what I did, or my friend had frozen shoulder and she just wanded over it, for 15 minutes and her pain went away, but mine's still here. That must mean that the wand's not working for me. And that's how we think, right? Oh, I took a pill and I didn't get an immediate reaction. That's not how frequencies work. The body is going to take it in, and the body's just know it is working. It is working, right? Even if you can't discern right away that something is shifting, it does not mean that it's not, because it cannot not work. When you give the body this frequency that resonates at the same resonance as our healthy cells, your cells are getting charged up, the body's unblocking the blockages, it's allowing everything to heal, and now the body can start to heal, but the body's going to do it in its own priority of healing. Maybe because it's your shoulder, but the body might be going, you know what? Like, we think that there's some gut issues here. So the body might start to work directly on the gut. And you're like, yeah, but I want the shoulder pain to go away.
That's
So
right.
just really pay attention as you're doing this to all the subtle changes that are happening. Try to stay really open and have the expectation or the intention that these frequencies are healing you. You want to be saying, I am healed. I am healed. My shoulder is healing. My gut, everything is healing. Okay. So that pay attention to what's actually happening. So that being said, there are a few things that you might, just possibilities of things that you might try. Okay. If you don't do these, it doesn't matter. It don't work. So this is just one for frozen shoulder, right? And it says number 1 is an option, but it's recommended. Try going up and down the spine 2 to 3 minutes, and then use the remaining minutes, however long you're going to be doing it, with just clockwise circles on either side. Now, this one has, if you start clockwise and clockwise, according to Dr. Kim, doesn't really matter. If you like that rule and you want to stick to that rule, stick to the rule. But it just doesn't really matter. Okay. But just wanted to show you just 1 or 2 of these, just to give you some ideas of possibilities. Here's one for heart disease. Now, I realize that heart disease is kind of a diagnosis. We are not saying that this wand is going to heal your heart disease. So just understand that, right? So if you have that, you're probably on medication. You might have some kind of an implant in the heart. We always avoid going over any implants. Okay. Let me pause and talk about that for just a minute. Because people are like, well, is it this kind of implant? Let me say it this way. If you have something that is now in your body that was not there when you were born, that is an implant. That can be teeth implants. That can be heart implants. That can be joint implants. That can be titanium and screws in your spine. Okay. Anything that was not there when you were born is an implant. Oh, let me also mention that can also be breast implants. And even if they are saline, you do not want over implants. Really important. Please don't ask me why and what will happen and all this stuff. Okay. Just know that according to the scientists and doctors that created this device, they say don't want over implants. Okay, so saying that, let's even say if you have a stent or something in the heart, you don't want to go up that far. You might want to go over to the other side, or maybe just go from here down. And then you can do some circles, just wanding up and around the back and back and forth on the back. And that can really help with heart disease. Might not make a whole lot of sense from us Westerners, because we're like, but the heart is here. What happens if I don't do it right over the heart? It's not going to help the heart. But now we understand that the heart is also, you're going to hit it on the feet, you're going to hit it on the hands, you're going to hit it on the ears. And that's how we're going to do that. I do want to do this one more because insomnia, oh my gosh, you guys, isn't it? Insomnia can be such a big issue. And insomnia can be caused by so many different things. It can be an emotional issue. It can be trauma issue. It can be nutritional issue. It can be gut issue. There's so many reasons. And hormonal. Thank you. What else, Kim? What are other things that you've seen with sleep and insomnia? Anything else?
Grief, anxiety. I think we kind of, but thyroid. Oh gosh,
just about everything, right?
Yeah.
I mean, so I've seen a lot of people really, their insomnia gets better. Some of them, though, I've noticed that it's after a few months, all of a sudden the insomnia starts to go away. And that's just because, I mean, my take on that is that that was the body's a priority for the body to heal, right? It's already opening, it's shifting, it's rebalancing the body. And until that happens, it's not going to touch the insomnia. But now once the body starts to open up and get balanced, maybe the hormone balance, whatever is causing the issues starts to get rebalanced. And now you're able to sleep. But that being said, there are a few places, if you are suffering from this, that you might want to try, which is upper area of the face for about 10 minutes up in here, especially between the eyebrows, maybe just blowing in here. On the face, we do recommend not a lot of heat. It's probably you wouldn't want to use a lot of heat. If you have one of the wands that only has 2 heats, like the premium, this one has a low blow and a medium heat and a high blow, high heat. So, what I do is I just move it away. Just move it a little bit further away so that it's comfortable from a heat standpoint on the face. And then back of head. So I don't know if you can see this, but just maybe doing back of head, little circles around the head. And then on the spine, and this says for about 15 minutes. So that's a long period of time. Don't know if that would work for you or not, but it's just a possibility from the middle up and the middle down, middle up and middle down. Can't reach the back, middle up, middle down, middle up, middle down. And that's how you might want to try it. So just try that and see if that might be helpful for you. I think I might have one more and then we'll stop. No, we're going to stop on those slides. We're going to take those off. So let me just share a couple of other rules that you probably do want to at least pay attention to. Obviously not wanding over. That's important. The company recommends not wanding over open wounds. Okay, nothing over an open wound. So you get a big gaping open wound, you go to the hospital, you seek medical attention, okay, whether it needs to be stitched or whatever it is. You break something, you go to the hospital, okay? They're going to cast it, right? And then when it's off, the cast is off, then you can wand to help the healing from there. You get an immediate acute condition. Oh my God, an acute condition. You seek medical attention, right? You don't wand. So these are fairly common sense, but it's important to know that. They also do not recommend it for pregnant women. We won't go past that. They don't recommend it for menstruation, although I will do a caveat on that, and that is one of the things that happens with the wand is it also does reduce blood viscosity. So we talked about the water viscosity, making it much smoother and easier to pass through, but it's the same with the blood, which is also really good because it helps with microcirculation. But what can happen through menstruation is you might find that it increases blood flow. So if that's a situation for you, if you try it, then obviously you don't want to do it then. For others, it just feels so good, right? That heat on cramping, you can just go right over the belly to reduce cramps. So just pay attention to that. Did I miss any of those, Kim? What did I miss?
I don't think so. I think you did. We
got it.
You've done good.
Okay. We got the contraindications. Excellent. Very good on that.
Yeah.
They recommend that when you do it, number one, and again, because this device was based and designed based on traditional Chinese medicine, they really recommend using as much heat as you can tolerate. Okay. If it's really burning, no, let's use some common sense. Certain places you want to go lighter. Okay. And out. You can always move it away from you a little bit. It will still penetrate up to the 30. So Kim, can you talk just a little bit about the idea of the heat with Chinese medicine, their philosophy and thought about it?
Yeah. Like I said, warmth is nourishing. It increases blood flow. When you increase blood flow, you decrease pain. You decrease, and believe it or not, you're using heat, but you're decreasing inflammation in the body. You know, when you put cold, I mean, think about when you put cold on your body, you know, you kind of do this, right? But when there's heat, you relax, and we have to have a relaxation to be able to nourish our organs, to be able to relax our musculature, to be able to bring in the healing that the earth, that the healers that are with you will assist you. And so that's a whole relaxation mode of heat, of warmth, of, you know, think about, we can think of the emotional component of heat too. We can think of, you know, when somebody gives you a hug, that's a very warm feeling. Of course, their body heats, you know, or a handshake or a hand on you, you know, when their hands are warm, it's very nourishing. It's very welcoming. It's very loving. And the same thing with warmth.
Beautiful. So, that's a beautiful way to look at it. And it just feels really good. So while I know that Western, you know, you have an injury, whatever, we're all about the ice. But in Chinese, no, you want to dilate it and allow the oxygen, nutrients and everything to flow through. For me, that makes sense to me more than the ice makes sense. But again, you know, everybody has their own ideas. So you experiment with that and see what you think. So one of the little rules that also they recommend is that you don't have a shower up to 4 hours after you do a whole treatment. I don't mean 5 minutes on your shoulder. I mean, that's fine. But if you're actually going to sit down and do a good 20-minute treatment, that you wait a good 4 hours to take a shower. And the reason for that is, yes, the water will probably be warm, but a lot of times you get in a hot shower, when you get out, you can catch a chill. So it's all about not getting chilled. Right afterwards, you don't want to sit right under blowing cold air, like a cold air conditioner, right? Because then you can catch a chill. So it's that same idea, that you just be careful, just pay attention to that and notice, does it make a difference for you?
Right.
So again, same thing that we're talking about. There were a couple questions here that I would like to get answered.
I tried to answer some while you were talking, just to, you know.
Oh, perfect. Okay. Yeah. So let's do this one, because Rachel, I know a lot of people have the same thing. She says, I'm going to, if you don't mind, Rachel, I'm going to show this across the screen so people will know what you're asking. She doesn't have insomnia, but wakes up, oh my gosh, right, 3 times a day with severe leg cramps. Nothing's helped. How can I use the wand? So Kim, what would you say? And then I'll give kind of my potential answer.
Okay. So she wakes up 3 times a night with severe leg cramps. So she takes magnesium and potassium and minerals, yet nothing has helped for many years. How can I use the wand to eliminate? You need to wand water, because obviously you're not absorbing the magnesium, potassium, and the minerals. You're not absorbing them. And our body, you know, people can take vitamin D3 and then have blood work and they have no D3 in their system. It's because there's no absorption. But I want to tell you, if you were my patient and you told me that, I would say you need some B12. But when we're talking wand the water. You can go up and down your knees and legs and for those cramps, but it's not the magnesium, potassium, and minerals. It's B12 or D3.
Interesting. So, and Rachel has been wanting the water. Good girl. Interesting. B12 and D3. Really?
Yeah. Especially if those cramps are kind of pulling cramps. I mean, if they're like a restless leg cramp, you know, there's so many different types of cramps, right? I mean, it could be looking at lymph system, and it could be looking at all different things. But let's say if Rachel, right? It's Rachel. Right? If Rachel came to me and, you know, like on telemed and said, this is what's happening, that would be my first go-to recommendation for her.
Beautiful. I love that. She was saying, what about doing a detox foot bath after wanding? Could. No. Yeah.
Yeah. You know, that might be too detoxing. You want that water. You've got the detoxing going on.
Excellent. So at this point too, I just want to introduce, for those of you that don't know about it, and we will be doing more talking about it. And that is, we now have our new 7 Wonders water bottle. And I'm so excited about this. If I shake it, you might hear there's minerals at the bottom. So it is a portable water bottle where it is not a filter. I do want to add that. So you do want to put in some clean water into here. You pour your water in and you let it sit for 3 to 5 minutes. And what it's going to do from the magnesium and the minerals in the bottom is it generates its own dissolved hydrogen. And it also makes it it's an anti-inflammatory, it's an antioxidant, it's an antibacterial, and that dissolved hydrogen, oh my gosh, you guys, I really highly recommend just go to Google and do a search on the benefits of dissolved hydrogen. I mean, there are like 1,600 studies on it. Most of us probably have not heard about this. So it's like, where is this coming from? But it is huge. And I just want to do a real quick testimonial. I've only had mine since Saturday. But one of the things that I am finding with it is it's definitely antibacterial. And it can also help, I believe, with the cramping because it really helps the absorption as well. Okay. And you can also add, this is 7 Wonders. You can add Wonders 8 and 9 by wanding this water. So it is glass. You could wand directly into it while it's going on. What I've been doing is wanding my big water in the morning. I add my wanded water into here. So it's already wanded. Now I have wanded. So now you've added the terahertz and the scalar energy. And truly, you guys, there is no better water on the planet. I believe that. It is amazing. Personal testimonial real quick as we keep going is I have eczema. I've had it forever. And because of that, I also have a lot of staphylococcus, which is a bacteria in my body. And so I'm always doing whatever I can to try and control it. It won't go away totally. The wand has helped, but I still get breakouts if I am stressed at all. Imagine that. Or I don't get enough sleep, or I eat something I shouldn't. You guys know the drill. So I've been, using this, and within a day, honestly, all of a sudden I recognized I was having some issues on my hands and around my mouth, and within a day it went away. So, and I also can get some leg cramping as well, Rachel, which is also why I say that. And after about 2-3 days of using this, I've noticed a big difference. So just letting you know that, just another potential to help you with that as well. It's really, really powerful. All right. I think we've covered a lot of it. But one of the last things, though, that I want to say, so we don't get on too long, is, again, just going back to the idea of thinking about our bodies as this whole being, this whole organism that's also part of the environment, that, we don't really know all the amazing, amazing things that are going on in our bodies all the time. When I even start to think about just everything that my body inside is doing to keep me up and going, that my conscious mind is not doing or aware of. I mean, digesting food and letting my brain reason, keeping an acid alkaline base balance. And I mean, we could just go on and on and on. It's just absolutely breathtaking. And when I look at that from that global perspective, I realize our bodies are brilliant. They are so brilliant. And so we give them this battery pack of energy, and we start to give our bodies that energy. Oh my gosh, the body knows what to do with the frequency, and it's going to help you heal. It's going to do whatever it can to rebalance itself. Why do we think, oh, well, if I only do my wand exactly counterclockwise 3 times and this way, only under a full moon and on an empty stomach and not hot, like if I have all these little rules, then I'll get the result I'm looking for. I mean, that's just, when you start to think of it in that manner, you start to realize, oh my gosh, maybe that's a bit insane.
Right, exactly.
Do you like that kind of analogy, right?
Yeah, yeah.
So keep it simple. Really, you'll see a lot of us will just say, oh, don't stop asking a million questions. Turn it on and blow. Point it and blow. Put it on your bottoms of your feet. Drink that water. Do the hands. Do some that. You're done.
Right.
Just don't stress out over, are you doing it right?
Yeah.
Right, Kim?
Yes, definitely. Definitely. If we learn not to stress out of whether we're going to do something right in the medical field, we would all be much healthier. We wouldn't overthink it. Do not overthink it. Just be in the moment and go. What, right? My go, just blow.
Go blow. Or go. Oh, no, I didn't want to say go blow. That don't feel good, does it?
But right, people just need to get over themselves, live in the moment. Let's get healthy. Just do it. Simple, simple, simple.
Keep it simple. Keep it super simple.
Yeah.
So with that, I want to thank you guys so much for coming on. I hope that this has been helpful and that you got some information on how to use the wand and just to relax and enjoy it and feel the relaxation and feel the heat and just go heal. Have a beautiful, beautiful evening, you guys. And thank you all for all the comments. We so appreciate it. And we love you all. So have a terrific day, you guys. Mwah. Thanks, Kim. I really appreciate you coming on. Bye, you guys.
Yeah.